Hi, I'm Dr. Gami Urbi, and I'm a dentist. Just like any dentist, our goal is to give you a beautiful smile and straight teeth. But, not all knows this, that as dentists, we are not only concerned about your teeth, we're also concerned about your overall health. So my passion, my specialty really is about myofunctional orthodontics. And it has a lot to do with facial balance and being able to maximize the growth of the face of our patients, being able to prevent joint pains or muscle pains in the future. Maximizing growth means be able to allow you to bloom as a person. We create beautiful smile and straight teeth. So today I'm going to speak to you about what causes this condition called malocclusion, or we call it crowding. In the vernacular, we call it pagsusungkin ng ngipin. I'm going to talk about cause and effect. So the first thing I want you to know is that majority of our children now, if you go around, you would notice that 3 out of 4 of these kids have crowded teeth and poorly developing faces. Why is this happening? Now, based on research, this is based on data collected, that most of these kids, they develop crowded teeth and poorly developed faces as they mature, primarily because of abnormal oral habits. In other words, if you have crowded teeth, if you have like a condition with an overbite, we call it, or overjet, this is actually not inherited from your parents. It is actually acquired. Now, what does it mean? As you mature as a child, as you grow, you develop soft tissue dysfunction or abnormal oral habits. There's a lot, but primarily there's one very common condition, and it's very, very clear and obvious to some patients. It is what we call mouth breathing. Now, take note, the mouth is not designed for breathing. It's your nose. Okay, so what happens to these kids? Because they grow up obstructed airway, which is very common nowadays because of allergies or, all these poor choices of food we eat. It causes obstruction of airway. So what happens, instead of breathing through the nose, which is the primary organ for breathing, they breathe through their mouth. And what happens is that they develop crowded teeth, small arches, and in return, the face becomes poorly developed. So it is not only about genes. It has to do with acquired oral habits or poor oral habits. Now, this is a particular case where you would see a patient with her mouth constantly open. So she goes around walking, going to school, doing her day-to-day activities with her mouth open like this. That's a poor oral posture. You know that we have one of the worst air pollution in the world. And when you breathe through your mouth, you will circumvent. In other words, you will bypass the most efficient filter system of the body, which is your nose. Okay? So what happens, the child gets easily sick. They pick up all these allergens, and then they develop allergic rhinitis. Or to some, they just easily catch virus or bacteria in their mouth through the lungs. So what we do is, as early as possible, when we see these kids developing an abnormal oral habit like mouth breathing, we do a therapy to convert oral breathing to nasal breathing. And that is my specialty. By doing so, okay, we develop better faces and less crowded teeth. Okay, so this is the cause and effect theory, meaning we address the cause and then the effect is much better. Now, you can see the difference here. This is the start, and this is after a few months or 1 year. You would notice that there's a significant difference in the face in just a matter of months. So we have converted her breathing from oral to nasal. Now, traditional orthodontics thinks this way, that when you are a child of 9 or 10, you should not have orthodontics or braces when you're 9 and 10, when your permanent teeth are not fully erupted. Now, I disagree because by that time, the problem has already worsened. In other words, when you detect a problem early, it is much easier to address rather than waiting until it becomes full-blown. So what others do, they just wait until the permanent teeth are fully erupted and then they put brackets just to align the teeth. Now, the problem there is this. When you only address the alignment and you don't address the root cause of the problem, the results long-term is relapse because you have not really addressed the root cause. So our goal is to address what is the primary reason why there is crowding and why there is poorly developed faces. So this patient came to us. Her name is Jessica, and she's actually the daughter of a good friend. And she came to me, and I noticed that her teeth are spacing. She has an overbite and a poorly developed face. Now, so what we do here, we actually implemented. She was only about 8 or 9 years old. And I said to the mother that we should address this problem as early as now so that it doesn't go full-blown. And true enough, after a few months, this is the result. So we actually did braces on her, but braces becomes very short. So what we do for the first 1 year or 1.5 years, we address the root cause with appliances and some habit correction. And then once the permanent teeth are all fully erupted, that's the time we put braces. So that's the result that we see here. You can see the difference. Now, this is a Myo brace. This is one of the solutions to this particular condition. So what we do, we ask the patient to wear this only at night. It is removable. It is only worn 1 hour during the day and overnight while sleeping. While they're sleeping, they wear it. And then they wake up the following day, they just clean it and place it in a container. This is how it looks. This is a Myo brace. They wear it at night. And then the following day when they wake up, they put it back, clean it, and then put it back in the case. So they are not wearing it in school, which is much better. Kids love it. And it doesn't only address the root cause, it also aligns the teeth, as you can see in this case. So there's a lot of other bad oral habits. We're not talking only about mouth breathing. There's a thumb sucking. There's tongue thrusting or poor tongue posture. There's open lip posture and different other oral habits. So in this case, this girl has a tongue thrusting. So we treated her tongue thrust, and then lo and behold, the teeth becomes more aligned and the faces are much developed. And so on. These are just some of the cases that we treat in our office. She's also a tongue thruster with thumb sucking, and we were able to address it. So to end my short talk today, please remember that as dentists, we are concerned about optimizing your health, especially your children, because they are growing and it is much easier to treat them at an early age. So the ideal age to have them checked is 9, 10 years old. You should send them to a dentist like me who is trained in Myofunctional orthodontics for an evaluation. I love kids. They are so easy to be with. And I also treat adults, by the way, but my forte, my passion really is treating kids as early as 9, 10 years old or even earlier. So this is my clinic. This is at Cebu. We have clinics all over the Philippines, in Trinoma, in Abriza, in Davao City. We have Mactan in Cebu and Cebu City as well. You can visit my FB page under Green Apple Dental. You can see us there and look at our updates. So if you want to talk to me, let's keep in touch. Let's discuss. And I am looking forward to seeing you and your children if you have the time. So thank you.